All right. So we're going to resume, and Karen, are you going? So we got. Oh, great. So we have three people, and we're going to start. This is, by the way, going to be a conversation on housing and a little bit on infrastructure as well. And we're going to start with Karen Durham-Aguilera because she's got to go and catch a something. Not knowing what's flying anymore because of the cancellation, so you could be training or something. But Karen Durham-Aguilera is the Director of Contingency Operations and the Office of Homeland Security for the U.S. Army Corps of Engineers. And we welcome you, Karen, and thank you so much.
Well, thank you. Thank you for the invite, and also thank you for juggling the schedule around a little bit. You know, I was really glad I was here for that last discussion. Because the National Disaster Recovery Framework, and I'll connect some of the dots here in a few minutes, it is new. It was launched in October 2011. We really didn't use it until Hurricane Isaac, which happened in the fall of 2012. And then the big-time implementation, of course, was Hurricane Sandy. So it is something that's new and is still maturing, but the principles are being used every day. And I'll give some examples of that and how everything is connected and still needs to be better connected at the federal, state, but especially the local level. So I'm glad that I was part of that. So basically, I am the Corps' overall disaster program manager. So I represent the Corps on the Emergency Support Function 3 with Public Works and Engineering. I also sit on the RS flag. That is the implementing body for the National Disaster Recovery Framework. So that's where all of the federal agencies are supposed to be connected, including the White House National Security Staff is there, Office of Management and Budget is there, Council of Environmental Quality is there, and every federal agency that is either leading one of those sectors or is supporting that is there. So the idea is you do connect what we're doing, and the Task Force Sandy recovery, because that's what it was, a recovery strategy report that was issued by that task force, and is also complemented by the states of New York and New Jersey with their recovery support strategies. Those recommendations that came out of that report is well worth reading. Those are recommendations for where the federal agencies are involved to actually implement, but also to make a connection with where the federal investments are.
Okay, we never interrupt our guests, but since you said something important, we didn't get it. Which recommendations from which report?
The Task Force Sandy, the Sandy Rebuilding Task Force, and all those recommendations and implementing guidance. There's no new authority created. There's no new money created. The existing money, for the most part, and the Corps of Engineers is one of the execution bodies of that, came out of the emergency appropriation. That was that $60+ billion appropriation. So there's no new authorities corrected, there's no new direction, but what there is guidance on how you connect all the dots, not just with the federal agencies, but where the federal investments are going, especially the grants for some of the granting agencies. So I hope that helps give a little bit of context to the discussion. Can I flip these slides, or is somebody else doing this? Oh, I'm doing it, all right. Okay, so just a couple of context things. For the U.S. Army Corps of Engineers, we have several roles, on the response. We are ESF3. Under the National Disaster Recovery Framework, we are the lead agency for the infrastructure sector, which includes a whole host of things. And then we have our own authorities for both, not just flood fights or response, but also long-term community planning. For the most part, we're talking about flood risk. But whether it's flood risk or the health risks, such as the pandemics, the main objectives are to reduce risk, and that's prior to an event. That's the preparation, the training, the exercises, the planning with state governments, local governments, communities, et cetera. Of course, during a flood or a hurricane or an earthquake, it's all about response. From every scenario, take action first to save lives, and then once you get past the life saving and life safety, then it's the short-term recovery. And then post-flood or storm event or post-hurricane or earthquake, it's a long-term recovery. It's all the repairs that can happen, the resiliency measures, and what you can do to both restore people's lives, but what you can do to make things better in the long run. And I'll connect that here in a minute. I threw this up here for the Corps of Engineers. We have We are the public works and engineering, the federal engineers domestically, but we also do a lot of international humanitarian response as well to other countries such as Australia, New Zealand, Japan, and so forth. So I didn't have enough room to show all the stuff that's going on, even if it's not a big event. But a couple things to notice that are recent: the Colorado flash floods that occurred in September of 2013, the West Texas fertilizer plant explosion that occurred last year, and then just a couple weeks ago was the chemical spill in West Virginia. So all of these things can be a combination of a federal response working in support of governors, and then especially working on the ground with the health sector. And the West Virginia chemical spill that affected water quality and drinking water, the health sector was very much involved, even before we got there. Just one other point, because I heard this in the last discussion. Hurricane Sandy was our first real-time implementation of the National Disaster Recovery Framework. And one of the things that we did, and that's the collective we with FEMA, EPA, the Corps of Engineers, and some of the others, as soon as the response started, we had people in the joint federal offices in New York and New Jersey already working on the recovery under the recovery framework. Because that was the lessons learned. And in Colorado, with the flash floods that occurred there, I was there a few days later, and once the initial confusion was over, those principles of the National Disaster Recovery Framework and the way that things were organized with the state, the National Guard, FEMA, the Corps of Engineers, and others, was another real-time implementation of that National Disaster Recovery Framework in the recovery. And that's the point. You bring people's resources together. There's authorities and monies that are specific to each agency or specific to the state or the Guard, but it's how do you combine all of that, and then how do you come up with a plan on how best to help that area recover. And in this case, in Colorado, you had all these mountain towns that were basically devastated with mudslides and rock, with streams, winter's approaching. So how do you put everybody's efforts together to make it where people can come back into those communities and then best plan, how to restore their post office, or how to restore the roads, or how to restore their streams. So that was a federal, state, and local effort. We actually called it a stream team because we were mostly working on the effects of all these streams and the damage, using those principles to figure out what that long-term recovery should be. So I'm really glad that even though this process is not mature, that we're able to use those principles, and I'm an operator, so I want to see action, to use those principles and actually get to the action, to do that actual planning on the ground using that framework. So I would tell you that part of it's alive and well, recognizing the maturity of the overall process is still has yet to occur. Hurricane Sandy, I put this here by reference, but the big point about this, the more you can do to prepare ahead of time, the better off you are. From the Corps of Engineers standpoint, we pre-positioned teams that would restore electrical power, people to work on temporary housing, temporary energy, everything that we could think of ahead of time. We staged our teams and materials in different places ahead of time, so we would be as close as possible to be able to quickly move out and react, and that served us well. And the other big piece that's not on this slide that was a huge problem that we ended up having to plan as we did it was unwatering the mass transit and subway systems in New York City. We had models to predict the inundation, but models didn't go far enough to show how devastating that damage would be. So we had to quickly assemble a team, and the Department of Transportation, the U.S. Coast Guard, FEMA, the Ports Authority, and the local mayors, as well as the state folks, were involved to very quickly plan how we would get in there and unwater those subway systems, because this affected everything. Movement of people, the health problems, eventually going back to work, you name it. So that was something we hadn't thought of ahead of time, that we had to quickly plan and gather that team together on the ground to make happen. And I'm glad to say that we were all successful in doing that. So you may not be able to read it, but I sent on them these slides so you can look at it later. If you look at PPD8, Presidential Preparedness Directive 8, there's a recovery continuum. And the preparedness framework, the response framework, the National Disaster Recovery Framework, the mitigation framework, which is also brand new, just got launched, there's a continuum throughout all of those phases. So we're either preparing, responding, recovering, or mitigating, or thinking about the resiliency of all these different sectors. So all the sectors that were talked about have a part of this. And if you look at the health sector, you see a few different places. You know, there's the mass care piece, but then there's also the social and the emotional, the psychological. You'll see parts of this in every bit of that continuum. So figuring out how to connect all those dots, especially with the state and the local recovery plans, is part of the work that lies ahead. If you looked at the recovery strategies that the states of New York and the states of New Jersey did, they were meant to complement the overall national strategy. They are very comprehensive. They go into great detail about all of these, and what's really refreshing, New York City has a long-term plan they moved out on that really went into the community planning, and I wouldn't call it redevelopment, but more refocus of these living cells, neighborhood cells, to take into account all of this. So there's a lot of good actions that's coming out of all of this, but people are using this continuum and using these frameworks to help the states and the locals do their specific planning. You know, long-term recovery, another thing that's ongoing right now, you'll hear this word of resiliency. And resiliency is used a lot of different ways, but what it's meant to do is what improvements can you make regardless of what area it's in. So the next time, and there's always a next time, when you have a big disaster, whether it's a hurricane or earthquake or river flooding, that area, first, there won't be as many effects from that disaster and you'll recover better. So we're looking at sustainable changes. The Corps of Engineers is leading a comprehensive study that was authorized and appropriated under that emergency Sandy supplemental to look at all the different things that can be done in terms of resiliency mostly within the states of New York and New Jersey that were impacted by Sandy. So there's lots of different sectors that are part of this. There's a lot of stakeholder groups. Rockefeller Institute's engaged in this. A lot of local planning that's going on to say what can be done. And one of the things that really came out under Sandy, there were 6 hospitals that were unable to operate after Sandy was hit. FEMA was working with the repair and recovery of those hospitals. The Corps of Engineers is contributing. But some of the lessons learned from that, and particularly we found some of these lessons learned after Katrina. And I was able to lead the recovery effort for several years in New Orleans, you know, post-Katrina. The hospitals. You know, it's unfortunate if you have a disaster event to go find out that your electrical rooms and your mechanical rooms and your surgical suite are in areas that are going to be impacted by flooding or anything else. So part of that resiliency is to look at the operating hospitals and see, are they resilient? Are the electrical and mechanical rooms on the right floor? Is the surgical suite able to be sustaining after you get hit by a disaster? The changes that were made in the hospitals in New Orleans basically are being done that way. And for the repair and rehab of the hospitals in New York and New Jersey, I think one of the first projects is being submitted to FEMA now under the mitigation grants. Those are some of the measures that have to be considered. The other thing that's not on here when you talk about preparation, looking at ahead of time when you have to evacuate nursing homes, healthcare facilities, hospitals, etc., you have to have the plan, the transport, and everything done ahead of time. The state emergency management plans have to consider that so that people aren't getting left behind, you know, after the storm hits. So part of these long-term recovery goals have those increased resiliency things that communities can do to do a real-time assessment of what they have in these critical infrastructure and then see what measures can be done. And there are federal resources available. We're not a granting agencies, but some of the other agencies are, like HUD, like DOT, that FEMA, you know, that can help with that. One of the discussions earlier was the natural disaster recovery framework and the principles. A lot of this was already talked about with the sectors, so I'll just go on to the next slide. So some of the guidelines in that Task Force Sandy recovery report have to do with rebuilding. While that report was being developed, the Corps of Engineers with NOAA, because we basically do a lot of rebuilding, not just with infrastructure, but also with environmental systems, with coastlines, with the way marshlands are being used, et cetera. So we established between our two agencies rebuilding principles so we could look ahead and even did projections of sea level rise 50 to 100 years from now so that community planners would have that information. And a lot of that has to do with anticipating the way the environment's changing, but also integrating the economic, social, and environmental part of this and to promote long-term community protection. These principles were greatly expanded under that Task Force Sandy implementation and recommendations. So I'll just talk about some of the ones that my agency and NOAA are directly involved in, but because it connects with this discussion. If you're going to have long-term strategies, it has to be working together, with stakeholders at all levels, and that's local, and that's state, and that's federal. That's the INVOADs, the volunteer agencies, the nonprofit groups. There's a whole lot of people that are involved in this. So this is all about leveraging partnerships and leveraging resources to truly make a difference. And that study I talked about a few minutes ago that's part and parcel of that. And then there's the systems. Everything's connected, whether it's the natural system, the infrastructure system that we build. You have to look at all these different systems to truly get to that long-term sustainability. We learned that lesson at Katrina. We're kind of relearning it big time with Sandy because such a densely populated area was affected. But you have to connect all these components and use the systems of the natural, social, and built to get to resilience, especially in coastal areas. And then there's the communicating that risk. Another thing that we saw in Sandy, those areas, people that live along the North Atlantic, despite the year before of Hurricane Irene and Tropical Storm Lee, really weren't prepared. Hurricane is not a no-notice event. You have days, about 4 days, especially to know a hurricane's coming and what you should do. Things like filling up your gas tank or going to the ATM machine and getting cash out. The plan with the health. And in those areas that aren't used to it, that type of thing didn't happen. So letting people know what their risk is, what they need to do to mitigate, can really be cascaded, whatever sector we're talking about. So getting that cognizance, having that be part of the local planning especially, is something that we're still working on. So some of the next steps, I already talked about some of the resiliency questions that the health sector needs to ask, especially for hospitals and healthcare facilities. The preparedness, local and state emergency plans have to have that as part of their preparedness. And on the resources, there's a lot out there. There's the mitigation plans federal agencies do. I apologize for the abbreviations, but HUREVAC is Hurricane Evacuation Program. It's a lot more comprehensive than that, but that's a service that we, the Corps of Engineers, do that's funded, we cost share it with FEMA, to provide to state emergency managers and local planners to look in their areas and help them do their statewide and even community-wide emergency planning. So those resources are available for states and locals to reach out and see if there's things they haven't thought of so they can do the modeling, even to the point of where do they get buses and how do you evacuate healthcare facilities. There's resources already available out there. And then the implementation of the Sandy Task Force recommendations, that's going to be going on for quite some time. In fact, there was just a principals progress meeting just last week, and those are going to be kept up with on a quarterly basis. So that's all I had as this part of the discussion. Of course, I'm here for any follow-up questions or discussions that you want to add.
Can you stay until after the other two?
Yes, I can.
You can? Okay, because I do want to come back. All right. Well, then, with that, I am really kind of good to get in from that down a little bit straight down into the housing issues, and we're happy that Tennille Smith-Parker and Tom Phillips are here, and so let me ask Tennille to begin. She's the Acting Director, Assistant Director, Disaster Recovery and Special Issues, the Division of the Office of Block Grant Assistance, U.S. Department of Housing and Urban Development. And Tennille, I think you've heard us talk a lot, if you've been here today, around the funding stream. So anybody that's got block grants in their title is of particular interest to us.